No, I wanted to talk about
back
that
on.
nutrition point that you just made. Say, make it again. Make the nutrition point again, because we never hear nothing we say.
All right. So the nutrition part of it is that some persons might have an adverse feeling to spicy food when they're on their medication. It is called antiretroviral treatment. So you may have an adverse effect. So you have a nutritionist in-house who will be able to guide you through the types of foods that you can have with the medication. Because some people you may have diarrhea, you may have some concerns with spicy food and feeling bloated and feeling nauseous. Some persons might even eat dairy products and find that it's not sitting well when they're on their medication. So that nutritionist on the team will be able to walk them through food types or food groups that they should have more of, and the food groups that they should have less of.
Yeah, that's wonderful. That's really good. You mentioned earlier about the support that you get in terms of disclosing. So, is there any attempt made? What if when I get there, I can tell you for sure that based on my sexual activities, I know who I got the virus from? Is there any sort of assistance in terms of speaking to that person, getting in touch with that person, or me just have to go face the music and hope him don't box me, don't kill me?
Wow. We do have in the public system, similar to when you have, if you look at COVID now, when we're doing, like you have that person that they would refer to as the primary case, or the index case, the case that started all the little pockets. In HIV, there's something similar called contact. It's still contact tracing. So once a person comes up, then we have what we call contact investigators. They now would sit with the client who has a positive result and help to walk them through their, I won't say sexual network, but help them to walk through the partners and where the timelines for the partnerships. Because you may in your mind believe it's this particular partner, But when you walk through your sexual history with that contact investigator, you may find that there are some other things that you needed to dig deep and bring forth. But you will be able to see like a timeline of your sexual partners, and the contact investigator will work with you now to see how best they can form a relationship or network to your sexual partners without trying to expose you as a person who is the male positive, or the person who gave their names to the contact investigator, to trace and form out where that sexual network is, because now we need to see where the HIV is actually flowing, because now we can form a network chain of the different sexual relationships around that positive person. So they do have ways of tracing where the person could have gotten it from, but I think it's more detailed in a lab, because from what I understand, HIV is because of the similarity to DNA. In a lab, they may be able, so don't hold me and fight me down with it, they may be able to use different persons' blood to kind of connect to see who passed the HIV to whom. But that's very high tech and
That's
very up there.
interesting.
Yeah.
Yeah,
So
man. Well, that is interesting. I
yeah,
didn't
very
know
high
that.
tech
That
and
is
up there.
interesting.
Very high tech and up there. But on the ground, though, contact tracing will help you to see where your partners are and how your network looks, and to be able to bring them in for testing to see if they could have possibly also be HIV
No,
positive.
but Nikisha, me talk about the woman who there with Juba, and it's Juba
Yeah.
alone. She and Juba alone, and she don't have no other man but Juba, and she know say it's Juba carry come here cause Juba out a road with all of the girls and cause Juba say must have gal and gal in a bungle, enough gal and gal in a bungle. So if she knows say Juba, is the advice for her to go to Juba and say, Juba, I did a test today and it came back positive. So I think you need to go and get tested as well. Or is it handled from a standpoint of a social worker goes with her, or they call Juba in and she and Juba talk with the social work? Like, how is that part of it executed? Or is it a individual one-on-one?
All right. So I like how you brought up several different scenarios, and I love how you went back to that fold where you said it's very So there's no one way to do it because everybody's situation is different. So,
Right.
I was part of that live earlier where you were talking about communication in relationship. Remember
Right.
now, it's her. She's having this illness and she now has to work through disclosure. So in the public space, we couldn't be the one for call Juba and say, Juba, Miss Ann positive, so come in because she want to talk to you. We
Right.
would be at, yeah, man, that is a no-no. So we would have to help her by having those conversations with her to find out what type of relationship she's in and build her capacity to probably have dialogue with Juba. But then the contact investigator will be able to use their ins and outs to find a way to get Juba to get tested without exposing that this person who you live with is the person who came to us and we are contacting you because of this person.
Oh, so, I see what you mean.
Yeah,
I see what you mean.
Yeah.
So you wouldn't actually confront Juba.
No,
but you would help her disclose to him.
Should it be a case where she's having a difficulty, because it might surprise you, some people are in relationships where they're able to go to their partners and say, this is what happened today, because they have built such a communication in the relationship that they can tell you. When you say, is your partner somebody that you can talk with about? And they will say, boy, I go man, da, da, da. And you'll be surprised to find that they come back with the partner for the partner to be screened. And then now it becomes a couple session because they're both now are aware of the positive status and are now able to get support in that same way how everything is activated. It's still activated and they're supported as a couple. But we'd have to work on the individual with the issue of disclosure to give her the tools. But we still have that arm from our contact investigators who are able now to connect to Juba outside of her. And we know want Juba become fully aware, so I really this one case. Contact Juba to bring him in as best as possible for him to also be screened without implicating this particular partner.
Okay, well, I've been paying attention to what's going on with HIV since in the 90s. And what I realized is that up until the point where Magic Johnson announced that he had HIV, nothing much wasn't really going on. And then Magic Johnson announced that he had HIV, he was HIV positive. And then a whole heap of other things come along to the point where now, when I have conversations with people in the 18 to 24 age group about HIV, them say, but miss, you know, so nobody not dead from HIV again. Look for Magic Johnson. Him LTS, matter of fact, him probably don't even have it. A lie with that tell. What do you say to that group of people who they're no longer scared of HIV? It's not something that they dread because of all of the great strides that have been made with the treatment of HIV and all of that. They are no longer trying to be careful. They say, well, miss, you only live once.
Yes.
So what do you say to them as it relates to how important it is for not just for them to know their status, but for them to actually be responsible in their sexual choices?
Wow, that's a big one, Shelly. That is not an easy tackle.
No, me really ask me own reason because me don't know, me don't know if it tell them because them ask them if you have, you still have a dead.
Yeah, but I say, hey, that's a big one, my love. Good. So how because you said it earlier, because of the immense strides that have been made in the HIV response in Jamaica, in a way we have made it's like a double-edged sword. So the generation that came in when the virus was at its peak and persons were dying because treatment and was not at its fullest potential and stuff like that, and stigma is a heightened sense of stigma. Not saying that stigma is not present, no, but back in those times it was like a death sentence for you when you heard that you were HIV positive. So persons were still had issues with condom usage, but were so scared of getting HIV and coming to test because they didn't want to know if they had HIV.
Right.
Now, because of the work that has been done in the field, you find that persons will come forth for HIV tests because it's like, I've heard it, the cancer worse than HIV. So, now we'll just take the medicine now, we're all right. But for me, when I think of it, when you position your life, you're now saying to yourself that I'm willing to take on this disease to live with me for the rest of my life because there's no cure. That's number one. I'm now thinking of my partner. And if that person is negative, would I want to bring this journey onto that person as well? Because if I don't use protection, I'm also inviting that into the relationship. You in the conversation earlier too, is that a sexual that's information that I would probably need to share in that sexual relationship if I plan to have it for a very long term. Now that becomes something that I would have to manage in the relationship so I don't expose the person whom I love. Are those some things you want to take on? Because in your mind, oh, we can't live with it. We know there's treatment, but there are certain things that come with having this disease for a lifetime. Keep in mind, lifetime. You are wed to this. There's no divorce in it. You're wed to it. So you may be on your treatment and you're doing well, but we have issues where you are on it, you feel good for 5 years and you're virally suppressed. That means it's so low in your body that we don't detect it. But you come off the medication and you find that you start breakdown or depreciate. Are you willing to take that on? Because that's a journey now that you must participate in. So when I think of it, every time I think, oh, and I hear the terms, oh, but cancer the worst and we can't live with it. Yes, live with it for the rest of your life. And is that something that you want to challenge yourself to do? Especially knowing that it takes a lot of response. Shelly, every day you get up, you take a vitamin. Talk the honest truth.
My girl, every day I get up, me eat a banana. I don't take vitamins.
So that is what you have to do. That's
no,
what you have to do. So
listen,
it's
you
a
don't
part
have
of
to.
your life every day.
I agree with you wholeheartedly.
That's how I think of it. Yeah.
I agree with you wholeheartedly, and what I say, I go a step further. I say to them that it becomes the most important thing in your life. Every decision that you're going to make as of your positive diagnosis is going to be affected by this positive diagnosis. So, for example, if you're dating somebody new, you're going to have to tell them at some point, preferably before you have sex with them. If you're going to start a new job, some jobs ask you to do a HIV test. If you're going to move to another country, a part of the application requires you to do a HIV test. If you're going to be going to some program that is very physically active and you might drop and hurt yourself and they might have to do a medical profile for you. So every decision that you make from the day you get that positive result, you have to consider it.
Your journey, yes, you're journeying with this. And I can say for a young person, when I hear them so cavalier about it, when you're around persons who are HIV positive and you see how impacting it has been on their lives and the lives of their family, especially if they have children, you realize that this is not something that you can be frivolous about. You can't just take it and say, oh, I just that. It's something that become very responsible about because you recognize that this is a part of your journey for the rest of your life.
Yes,
and
that is it. That is it.
And it's dependent on you managing your health. So it's not people out there, so it's you being fully responsible for your health. You have to make your appointments. You have to take your pills. If you go to the nutritionist and you get your diet, you have to work with the diet because you may start feeling ill with the tablets or your medicine that you're taking. It becomes something that you must manage and be fully aware of so that you can actually navigate that in a healthy way. I think it's a lot of responsibility, and then you have to bring it into focus of people that the responsibility is now yours.
Yes.
It's not somebody else out the road.
You are first and last line of defense. It is all down to you. And your results are directly linked to what you do and what you don't do.
Yes. And can you, now the question comes, can you manage that? Because if you feel you can, then by all means, go the walk that you think you need to go. But can you manage that lifestyle? Because it's a lifestyle shift now.
Yeah.
And can you manage shifting your life in that dramatic of a way?
Okay, which brings me to my other thought about education. I think that education is very lacking in this space. And when I say lacking, I'm talking about, well, this working in the space that there's a lot of restrictions as to what we can say to people who are under 18 years old. And I think that they need to be told the full story. I'm not suggesting that we sit a 7-year-old down and tell them about the HIV status, but I think that once you pass 14, 15, 16 and onwards, you should be able to know all the story. And I say all the story because telling them piece and left out piece don't make no sense.
According to my 17-year-old, the full 100.
Full 100. There you go.
Full 100. Tell him everything. Full 100.
There are parents who feel that the best way to protect their children is to just keep them ignorant, and they use the word innocent a lot because for some reason if you're innocent it means you're not supposed to know anything. You must just walk up and down in the world completely unaware because you're innocent. I disagree with this concept.
I disagree as well. I think age-appropriate information is critical.
Correct.
So even that 7-year-old can be told about good touch, bad touch. That 7-year-old can be taught about puberty and understanding the body and body development, so that when they're around their other little 7-year-old friends and them play dolly house, you don't know which other little 7-year-old is HIV positive and playing dolly house with your child. So you must arm them with age-appropriate information so that even outside of you being present, they are aware of what are the things that they need to do to protect themselves. So I don't support not telling our children you must. My son that tell me say them are little people too, you know. Them are people too that have opinions and they have ideas. So you can't put them head in the sun. My son says so they head in the sun and the whole of the body out the door. That not make
out the door. Exposed.
Your head in the sun thinking that that's protection. That's not.
Something as simple as even sexual arousal, understanding sexual arousal. One of the things that a lot of parents they don't want to accept is that their children experience sexual arousal. And because their children experience sexual arousal, when they do that, they tell them to go and sit down or it's demons or them tell them some kind of thing to dismiss them, miss it. I was talking to a girlfriend of mine the other day and she and I was on video chat talking like this, and her daughter, she's 3. She come up to her and she grab her hand and she put it between her legs and she wiggle like this and all of that, and she put her hand on her head and she said, "You see why I cannot leave my child and go anywhere?" That's what she said to me. She said, "You see why I cannot leave my child and go anywhere?"
It's no joke. It's no joke.
She doesn't have the words to explain what it's doing.
Yeah.
You understand? So
another family member and don't even know what she's doing. So we have to be very mindful of how we position ourselves as parents and the types of sexual reproductive health information that we give them. But you cannot say you won't give them. You must. What we have to do as parents is find the information that's age appropriate. And the next part of it, Shelly, no laugh. If you as parent not comfortable to talk about breast and titty and sitting there, then you know so you can't talk to the people them. You yourself uncomfortable. That is uncomfortable, you know. Because you know
that's the most important part of it.
Parents, grown adults never look on themselves and so therefore they are so outside of their sexual self that when those children are growing up, they cannot give them the information or they can't guide them because they themselves weren't guided. And they don't have the resources and the tools to impart it in a way that says to them, you're growing up, your body are going to feel a way here. Yes. So
how do we solve this problem, Nickeishia? Come, help me there. Because this is something that I'm actively working on.
That's something we get me vibrant. I can't get me vibrant.
No, man. This is something when we actively are working on. Because I think that when I look at relationships between men and women, I realize that it must start with the relationship between boys and girls. And we have to change the way we teach boys about girls and about so you don't when you have conversations with boys and girls on the same level and they understand that they are equals, they become more respectful of each other. So my intent is to educate them at grade 3 and grade 4 and grade 5 and grade 6 so that they understand that when they're in grade 4 and their female classmate starts their period, it's not something for him to laugh about. And he's not supposed to go to her that and take out her little pouch and laugh at it and run and tease her, which is something that they do.
Because they don't understand.
Which is something that they do. And what I find is when I go into the schools and I teach them and I show them and I make the connection, I say, your mommy uses these products. The relationship between that little boy and the girls change because now he connects that this is something necessary and the mommy have to do it. So it must be supportive and not be disrespectful to her. So that is one part of it.
One part of it, yeah.
We must talk to them about sexual and reproductive health outside of being about sexual intercourse. Because one teacher looked at me and said to me that she does not want to include the boys in the conversation about period because when boys hear the word vagina, they think about sex. I said, really, they only think about sex when they hear the vagina. That's because that's all they are taught about the vagina. They should understand that they come into this world because of vagina. Because of a vagina.
Yeah.
You understand me? So, help me please. How do we, you and I, and others like us, who work in this space, how do we collectively find a way to make a real impact so that we do not have this conversation 20 years from now when we're talking about people who between 18 and 24 who are dying from AIDS in an age where they don't have to?
I think that you said it earlier. So education is one part of it, but it's a big approach where we need not just education, but we need to have a cultural shift. So the community support. We're thinking of that community with church. We're thinking of that community with the people who are in the physical space, and we're thinking of the community as your family. Because it's conversation. So when you're there in the kitchen and cook, do you talk to your children about their sexual reproductive health? When you're there in the set, you eat the food and you see a kissing scene on the TV, do you pause and ask them what they understand from those things? Rather than say, get up, you're not for watch them, stop me here. Do you give them information to say to them, you're not yet at the age to be watching this? Or do you understand what you're watching? You know, say X, Y, and Z. Do we have conversations at all with our children about the things? Or do we go, once I'm nothing about kissing and hugging and nothing, a sex, so I want them to get up and move. Do we converse with our children? Yeah, man, I cover them. I said, don't look enough to watch a party. Do we converse with our children? Because that's also a part of the education. So the education is not just in a school setting. Education is in your home, in church. When you're driving at a taxi, what are the discussions that our children are hearing? Because that informs them. That teacher that says, take the boys out. You have missed an opportunity to inform them they're going to be fathers. They're going to get someone pregnant. Because they would not have understood from a young age what the period is about. Because we divorce them thinking that they're not critical to family planning. They are. If we don't start including them from early, then when they get to that age, they will still be unconcerned about ideas of family planning and building families and about their sexual reproductive health. That's why we have the issue where men actually go, so there's one contributing factor where men go later to health services, because anytime we have prevention discussions, we exclude them from those discussions.
Yeah, we just separate them. And from my show,
the people are the because we're going to talk to girl now about health. But we must talk to the both of them. Because in the end, they relate. They relate. No. So if they don't know each other's bodies, how them will relate and relate successfully.
Between me and you know how much mother tell me about my body parts because I give our son panty and pad to put on. I make our son all a panty. This one lady tell me say I'm turning our son into a homosexual because I give him a panty.
What? Then if
right?
never take a people girl picnic.
No, but hold on. The little boy came to me and asked me for a little package to carry home for his mother. Because we don't automatically give the boy packages. But if they ask her,
right?
I remember the little boy because he came to me and said, Miss, I can get one of these for my mommy. And I give it to him. So him go home now and ask him mother to let him wanna fear panty them. So him can share what him learned from the lady at school today. The lady don't do nothing more than call the school and give it to the poor guidance counselor, and the principal deal with them wicked. The principal called me, asked me if we can come back to the parent here because she both is skin out her bottom, show them. And I went up to school and I take my cousin, miss, and I sit down and she cuss me and she tell me, oh, me I turn her son gay and all kind of something, and she give it to Miss D, and me just take my cousin, and when she done cuss me say, why you live? Completely throw her off because maybe she not expect me to ask her that. She said she not, and I even want she have, and she not gonna make me come and cover up her picnic. So me say, deal with her, because I tell her that she had deal with me wicked enough. I said, so, what if you got sick one day and he needed to help you? Doesn't it make sense that he knows about this? It's in that moment that it occurred to her. That maybe this information might be useful.
Yes. Can you realize now it's useful because it's benefit her?
Because it's benefit her.
You realize now? It is beneficial now to she.
And now she have a seat. All this time she has stand up, you know, she one cuss word away from boxing me in my face and I make it effect. By this time now she have a seat.
Run.
And she said, she never thought about it like that.
Yeah, because you shifted it away from, because now the discussion is not about him being emasculated, it's not about him being girly, it's now about him being supportive to his mom. So you were magical in that moment by shifting. Who's going to be around other women, should that be his sexual orientation? What are the chances if he has a daughter, a girl child, that he doesn't know anything because you would have taken the opportunity away from him?
Exactly. And you know what? That's a good question, but I purposely don't ask that question. I want her to see how it will benefit her now. How knowing about it now is a good thing.
Because he might support him. Yes.
Yes.
Yeah.